and I am the senior manager of Game Plan, which is co-hosting this series or hosting this series on behalf of COPSIN, the Canadian Olympic and Paralympic Sport Institute Network. Game Plan is our athlete wellness program and a collaboration between the Olympic Committee, Paralympic Committee, and COPSIN, as well as Sport Canada. And our mission is to help you be the best you can be on and off the field of play. And a way we do that is by leveraging the experts within COPSIN and within the system to teach you about topical issues. And so that brings us to today. And so we have Karen McNeil, who I've been working with very closely over the past couple of months in our COVID response, who's the lead for mental health for the Canadian Olympic Committee, and Dr. Andy Marshall, who is the Chief Medical Officer for the Canadian Paralympic Committee. And Annie, have I missed anything? Do you want to quickly jump in and say anything about the series that I might have missed?
Yes, and my apologies. I'm also not really camera ready, although I'm not wearing a hat. And like Tom said, our usual intro person, Kara Button, we have a bit of an emergency at the office. So my apologies for this intro and not our usual intro, but I think you covered it all. I think it's very pleased to have today two great speakers, Karen McNeil and Andrew Marshall, to talk about a very important topic. Yeah, so I think I will leave it to that, and I will let Karen take it away.
Great, thanks guys, perfect. Yeah, and just to start, and it just as Andy's pulling up the deck here, want to thank the COPSIN network and Game Plan. They've been working tirelessly to really launch these webinars and this information and bring some really great information to our community. So thanks for all your efforts, and thanks for having us here today. We are pleased to talk a little bit about the return to sport. And we really want to shed light on the perspective from a physical health point of view, in addition to a mental health point of view. And so really what we're going to be doing is discussing some considerations as we're returning to training, in addition to shedding some light on the potential psychological reactions and thus some considerations that you all might want to take into account as you're mapping out your procedures or that you're re-entering the physical training space. So I think, you know, we talked a little bit about introduction. So thank you for that, Dr. Andy Marshall. We're really happy to have him here with us, the Chief Medical Officer with Canadian Paralympic Committee, serving in Pyeongchang and Lima at the Pan Ams and then up in Tokyo. Lead physician with the volleyball team, our Canadian volleyball team, our men's side, consultant with wheelchair rugby. And on the side, he does some orthopedic surgery, you know, just to round things out. Myself, as Tom mentioned, I wear multiple hats as well. So lead mental performance consultant and mental health counselor with the Canadian Olympic Committee. In addition to, I'm an MPC, so that term, mental performance consultant, MPC, with a variety of our sport teams. And then also I'm wearing the hat of chair we've put together a COVID-19 mental health and mental performance task force, which I'll talk a little bit about later on. And so for today, really where we're going to focus our attention. So if Andy, if you go to that next slide. You know, really what we want to do, Andy's going to start us off, sorry, Dr. Marshall is going to start us off with return to training considerations and really representative on a variety of task force and the Sport Medicine Advisory Committee. So in the thick of how we do this in a safe way. So we'll bring that information. I will then speak to a little bit of the psychology of return and as I said, psychological reactions and some considerations. And then we want to open it up to questions and answers. So we'll each take about 15, 20 minutes and then we'll have about that same amount of time for questions at the end. So I'll just turn it over to Andy or Dr. Marshall, sorry, to get us going.
Thanks. It's Andy, by the way. That's fine. Yes. So, you know, I'm going to, if it's okay, take a second or two just to go back to February of this year. And we were actually in Tokyo doing a site visit. And that's when everything kind of started shutting down. And Canada really at that point didn't have any COVID, but certainly it was a concern in Japan. And I remember one of the first, there was a team that wanted to go to overseas. And then there was a question of whether they were going to be able to go overseas. And of course, we all know that things got shut down and many, many, many things have happened since then. But it's amazing to go back, and that was literally 3 months ago at all the changes that have occurred. So at that, while we were in Japan, we got together as the Sports Medicine Advisory Council and said, we have to sort of come up with some sort of recommendations, because right at that point in time, there wasn't, and no one really knew what to do. So it started off with us doing one paper, looking at what were recommendations in terms of different things. And it sort of blossomed or blew up, is depending on your point of view, into many, many papers and many different meetings, and also the Canadian Return to High Level Sports Task Force. And what we've done with that is we've tried to give you a roadmap of minimal baseline things that you should be thinking about, or how you should progress, because we know everyone wants to get back to sport. It's just how we get there. We do have some overlying sort of guidance. And the first one of that is that we want to protect the health and safety of both the athletes, their coaches, and all the rest of the team. We also wanted to make sure that we took care of protecting the health and safety of the people in that community and Canada in general, because it wasn't just about sports or just about the athletes or just about the teams. Many of the things that we come up with are medical in nature, but I think that, we try to make them so that everyone can understand and that everything can sort of go forward in a sort of logical way. Last thing I just want to get out there, and it's mentioned many, many times and will be mentioned many times, is that we're not trying to trump any kind of provincial or federal health guidelines. And so we always take those into account. And sometimes, as much as we would like to, or we think we could, those are the baseline, and we can't, this is not a way to get back and cheat the system. So we just always have to remember that. So we took those basic sports keys principles, and then we looked at general return to sports guidelines, added in what the public health authorities were telling us at that time, and have adjusted it over the time. And we created what we called the Return to Sport Assessment Tool, or RSAT. We'll talk a little bit about the components of that in a minute. And then from that, using that tool, we then looked at different sports clusters, whether it be combat sport, whether it be a team sport, whether it's, and tried to differentiate. Obviously, sports don't come in a package to say that this is combat sport, but it's an indoor sport. They do meld, and so the teams can look at parts of these different components and put it together perfectly for their sport. We also looked at standards of activities and created the papers that are outlined here. So the first was the RSAT. We then, through the task force, put a return to high performance sports framework together, and we'll refer to both of these. And one thing we did realize as we did that is that it wasn't just about high performance sport. It wasn't just about the Olympic and Paralympic athletes, but we had to think about the provincial, the clubs. And so we did come up with a risk assessment tool for club sports, which is a little more didactic in terms of you should do this, this is recommended. But that has proved to be quite useful to a lot of different sports and associations as they also look to get facilities open and get back to training. So the first thing we do is we get the risk assessment to, and this is the first step and kind of determines where you start. And it goes from negligible, which would be great, right up to very high. Now, obviously, the last couple of weeks, or at least the last month, we were in that high to very high stage where the disease wasn't contained. There was a high risk of community transmission. And so really, like the government did, we said, non-essential activities, that's it. People stay at home, only go out and do what you need to do. Try not to order stupid things from Amazon as much as you can, and just take care of business. As we're now moving from high to moderate, the disease is contained. There is some risk in the community still, but we have to be, they're looking and trying to zero in. Is this only in certain cities? Is this only in certain groups? Obviously, the nursing homes have been hit hard, and in the surgical world, we saw that quite significantly. And most of the patients we had during the pandemic has been people from nursing homes that were COVID positive. And we are hopefully moving towards the low and very low. And certainly as we do, the provinces are allowing us to do more activities and to increase what we do. So the risk assessment basically is made up of these 6 questions. Training in an area with active local transmission. Until about a month ago, that was nowhere in Canada. We now know there are several provinces where they haven't had any cases, and that's improving. And in places like Ontario, we're actually starting to break it down so that if you're in the Toronto area or Peel, yes, you're still in active local transmission. Well, if you're in other areas in Ontario, you can be out of that. So that's one question you have to answer, and if you can say no, that's a good. All of these, if you can say no to them, then that's a good option. So our venue is accessible by multiple groups, and certainly at the CSIs, that's one thing we are trying to do is only have the athletes, only have certain groups, separate them by time, separate them by space, and that obviously is a better environment for reducing your risk. Are we bringing individuals from across different areas, especially areas where there are active transmission, to areas where there's less transmission? And that's obviously, people are thinking, can we go to Charlottetown, PEI, or could we go to Saskatchewan where there are less or no cases? And what does that mean? So obviously that's one thing we've looked at. And one of the latest things the task force is putting out, and will come out today actually at 4 o'clock, is what are the recommendations if you're coming from one of those higher risk areas to a low risk area to train. There are certain groups that we know have a higher risk if they get COVID of having a bad outcome. And certainly the people over the age of 65, sorry for any ageism, but it's just, that's the number. Also people with respiratory disease, heart disease, and certainly some things that have come up recently in terms of individuals who have had blood clots in the past are at a higher risk. So once again, if you can say there's no individuals in that grouping, that's a good thing in terms of your risk. The next question is your training considered high risk? So obviously a combat sport, it's hard to stay 2 meters away and still have combat. And certainly things like sharing balls, sharing the landing pits, things like that. So if you can minimize those or change the way you do things in your training, that can also help you. The last thing is, we know that if you're outdoors, it's better and the risk of transmission is lower. And so sometimes we've been looking at sports and potentially could we move the training outdoors, such as beach volleyball is a perfect example. So that obviously this time of year, it's great. We can finally get outdoors and we can do some training, which is preferable to being in a gymnasium or a closed environment. So once you get your risk, then we look at the mitigation strategies. And I will save you because it's 59 questions and they're very specific, and a lot of them are very medical, but some of them are more communication and they look at other areas. These are the main groupings that people go through. And, you know, I think that this is not something on an athlete point of view, but more on the team and more on the national organizations to look at these and to prepare these. Emergency preparedness and response are quite straightforward, and they, you know, something that we say, okay, someone gets this, someone comes down with a positive test, this is how we proceed, this is what we do. Some of them are very, you know, having logistics to make sure you can isolate people and just things like that. which all of these, every time you do one of these mitigation strategies and you have a plan for it, you're also reducing your risk in case something happens. So when you put these two together, then you get a decision or a ability to make a decision. So this is kind of what we do, is we look at the training environment as the CSIs are opening up. For those teams that are in CSIs, they've gone through a lot of those processes. We look at the risk assessment for our actual sport and our team, then try to mitigate it down, modify it. Can we modify some of those risk factors? And then we make a final decision whether we can return to training, whether it's a small group or larger. And this is kind of a way of thinking to take our brains through it. Phase one is where we've been, and that's where we've been at home. We've just been doing our own thing. We're not really going anywhere. To phase two. And phase one to phase two is probably the biggest jump. And what you're doing there is you are going from being in your own small environment to sharing a bunch of small environments together. And this is often allowing us to get back to our training spaces. It's also meaning that we transport and we go to places, whether that's, in this case, we recommend usually by personal vehicles or not using public transportation and not buses. Phase two to phase three, we're also looking more at camps. The advantage to a camp is you all become one bubble. And that's what I'm trying to show with this, is that we become one family, much like we are at home. We don't have to distance from ourselves. We become one unit. That also may allow us to use more of a bus or shared transportation. And this is where we're looking at spending time in camps, potentially away from home. Phase four is what we're all aiming for and what we're hoping for and looking forward to, but you can't go from phase one to phase four. It just doesn't happen. And this is where we were able to fly. This is where we're able to look at competitions and being away. So this is sort of the flow as we go through. Obviously, we're in the training. We're demonstrating that we have the capacity to organize ourselves and get things ready. As we move into phase two, we are looking at times when the gathering size, maybe it's less, maybe it's 50 as they're moving to in Quebec, maybe it's 100, but allowing us to get bigger groups together and also looking at travel. This is where testing is coming in, and that's another area that the task force is looking at and potentially looking at trying to be able to either get local access for you to get testing and make sure that we can get results and keep that information, as well as we have looked at the possibility of doing testings at the CSI, which is still in a state of us sorting out. Phase three, we get into more border crossing. And what that means is really very variable. Certainly our biggest danger may be our neighbors to the south. And we, in the past, would travel back and forth all the time to there. It may mean some quarantine, both when we go to someplace and as well as when we come home. And obviously that has to be put into the equation. Is it worth going for a 2-day competition if you have to quarantine for 2 weeks when you come back? As we move further along, borders are open. We may have some persisting quarantines, but maybe not in all countries. And then number 5, we get back into the normal travel, no restrictions. And I've put the needle here because, we all think and we all hope that we're looking at some sort of immunity, some sort of ability to test as well as treat so that we can avoid that. And obviously that's where we're looking in the end to getting back to being ready for the big competitions that are coming up in the next year. Sports have taken all this information and they have put it together. So sometimes it's an international, such as World Rugby. Sometimes it's a national team, such as Swim Canada and Canoe Kayak, which is probably one of the first groups that came out to give direction to their athletes as well as to their clubs. And one thing, the one thing I love putting the canoe kayak up here, because the one line, it's very prominent, it's at the top, is once activities are permitted by the public health authorities, you can't cheat, you can't jump ahead. Just because you made a fancy document doesn't mean that you get to trump what everyone else in the province or city is doing. So this is just my summary to sort of show we have been pretty much in this first stage where we're preparing, we're educating people, both the staff as well as looking at educating the public in general and athletes and teams. We're working on getting access and looking at the training environment and we've agreed to protocols in case of something happening, such as a positive test, or if there was concern if someone had it, how do we move ahead? We're also at this point more in this stage where we're looking at criteria for resumption, and then we've talked about the different sporting activities at that point. Thankfully, in the last week or two, I've seen probably more questions moving into the third grouping, where we're looking both at assessment of teams, sports, as well as down to the athlete level in terms of getting back to formal training. And this, can be different. Certainly in the para sport world where I work, we do go athlete by athlete, because sometimes even though they play the same sport, some people have different medical conditions which can significantly affect when they can get back to training. And that's where I talked about the vulnerable groups. And then of course, as we move from this get back to training, we want to continue to monitor things. We want to know what we do if in case there is some sort of outbreak, whether it be in the community or within a team or sport, and then how to manage them. And the last part of that I didn't put a bullet for was that what happens if you do have a positive COVID test, and how can you get back to sports after that? So this is the process that we've been going through, and we continue to work with the task force on progressing these along. So I'll stop.
Well, thanks so much for that. And yeah, as you can see in the chat box, if you have any questions there, then please have any questions. Sorry, I'm multitasking. I'm trying to do this speak at the same time. It's not working. So I'm going to do this first, and then I'm going to speak. There we go. Yeah, if you have any questions, just put them in the chat, and after I'm speaking, we'll be sure to address some of those. So we've gone through that. So thanks so much for that, Dr. Andy. And I think, as we're hearing all that information, it's quite complex, as you can imagine. And so there's going to be reactions of that. So in this portion, what I'd really want to do is talk a little bit about the psychology of return to sport. So first of all, I want to acknowledge my colleagues across the country. A few others presented already on this information. We have task force and who have contributed to what I'm going to disclose here. So thanks to everyone who's contributed to this. Once again, we have established the COVID-19 mental health, mental performance task force. And really, it's a group that got together at the beginning of all this to ensure that there was some leadership and some guidance and some planning, but also alignment across the partnership groups. So we're represented by Game Plan, by OTP, by COC, by CPC, we have a coach representative to have that population, in addition to the Canadian Centre for Mental Health and Sport. So it really informs what we're doing. So a large part of what I'm going to share here has come from this task force, and we've had meetings with our mental performance consultants for, every couple of weeks since this has started. So really getting some rich information. So first of all, I think if you've been on a bit of a emotional roller coaster through this process, such as I have, you wouldn't be alone. In March, we all experienced one of those where were you when moments. The World Health Organization announced a pandemic, and we all had to adjust and adjust quickly. This was an unprecedented event with no playbook, no rule book. And so it'd be very normal that emotional reactions would be high. And given when we have uncertainty and unpredictability, our over anxious mind can over-predict danger and under-predict our ability to cope with it. And so really from the very beginning, it's really important to be aware of how we are responding. And as I put some of these words up on the screen, I just want you to notice what you've experienced over these last 3 months. And if you have all of them, like I may have, then you would be normal. It's just our emotions doing our job. And so the very first things is to acknowledge them, validate them, and normalize it. The second piece, though, what we have to be careful as we're having these reactions is that we're using that tool of curiosity and we're not letting our emotions run the show. And so in this regard, emotional agility is going to be key. And this really comes from the work of Susan David. She has a book, she has Harvard Business Reviews, a TED Talk, highly recommend Susan David, Emotional Agility. But the whole idea here is to be experiencing what our reactions are in their fullness with two things: compassion. So yeah, I'm reacting, I'm feeling overwhelmed, I'm feeling anxious, that's normal. And second, curiosity. What is this emotion telling me that I need or that's important to me? And so with that, what we want to do is make sure we're using our emotions as data, as information telling us, signaling us, but not as the director. And so as we go into behaviors, as we're returning to group training or even absorbing all the information that Andy said, it's if you're feeling overwhelm or anxiety or excitement for that matter, it's just information for you to tell you that you're passionate about your sport, you like to plan, uncertainty is hard to navigate, right? So I think that's one of the biggest things as we're thinking about this is to be or have that awareness. And so with that in mind, let's look at a few reactions or responses you may see. And as we return to group training, there's going to be a range of responses, and one individual may experience all of these things. So we're going to have, a group that's they're going to return to sport with minimal issues and just the let's get back at it mentality. This whole culture of invincibility in sport is something we're going to have to just pay mind to and make sure that everyone are following those procedures as Dr. Andy mapped out. I think the other thing, the second range is fearful and anxious of either the exposure and potentially contracting the virus, or we've heard from individuals about injury and have they trained enough while they've been off. So it's when you have this anxious of being exposed to environment, it's almost like that caveman and saber-tooth, that primal response is you're going to be turned on quite readily. And so we just have to make sure that we're focusing on the facts, information setting, and helping people process those normal responses. And then we're going to have a group that were personally impacted, whether there was a fatality in their family or job loss or financial, in addition to the transition anxiety and just what it's been like to be isolated or even going back into training. And so the thing to realize is all these different responses will need different supports. So, just as Dr. Andy was saying in the Paralympic, it's not a one size fits all. We almost need to address some things individually. And so taking a bit of a deeper dive on some of our calls and some of the information that's been coming in, we're hearing a few things. And so one thing is that re-entry anxiety, which is just that form of stress associated with going back to previously established routines. And so, it's whether the stress of how do I travel? How many people are there? Do I have to get tested? What's the protocol? So there can be an overwhelm just along with some of these procedures. Lost in the familiar. When we were thrown into training at home or being more in isolation, our brains had to adapt to that. Now what we have to adapt to is going back into a familiar scenario where we have a mental map of, I hug this person, I go over here to get my water, I train in this way, which is going to be probably completely different. And so people are going to need transition time to unplug from that and get used to the new. I was, one of my first Olympic Games was 2002. So this was 6 months after the 9/11 attacks and going into that environment and the security and the double layers and the triple layers that we had to go through versus what we were used to can put quite a cognitive load and create that frustration. So it's really mapping out and helping everyone understand what they're coming into and having time to adjust to that. Comparison stress. So not only, there's a few comparisons. So number one, where am I at? Coaches, staff, leaders, athletes in relation to where we should be, right? So there's that stress there versus where are we now? And then there's the other comparison stress, as Dr. Andy mentioned, different provinces are opening up at different rates. The country, the world is opening up at different rates. So, you know, our counterparts in Europe are able to train and we're not. So really getting people focused back on what's in their control. And then lastly, the mental fatigue and cognitive overload that comes with all of this is just another load. And the stress response is super important and super helpful. Helps us get ready, helps us focus, but it's meant for a couple of hours or a day, not for a 3-month period. And so that's where we need to make sure we're getting on top of this and over-indexing on those stress management and resilience skills. So I just wanted to shed light onto, you may have seen this before, but this is the psychosocial phases of disaster model. And so thank you to Summer Christie and Susan Cockle and Alex Hodgkins. They presented a couple weeks ago. And so I've pinched this slide from them. But really this model kind of shows you the different phases we'll go through and we've gone through throughout this experience. This will map nicely as well to probably the return to training, where we'll have this honeymoon effect where people are excited to get back and there's optimism and all those different things. And then after that wears down, some frustrations with things being different or the protocols that are required, some of that disillusionment. And then we're getting into that recovery and reconstruction. So just sharing this as a way to house how we may be processing these things as we move through. So given all of that, here are a few considerations that we as a group have discussed in addition to a few things that I've come up with. So I think the clarity of the procedures. And so I say have these plans buttoned down. And I think what I'm speaking to is number one, for the organizations, have it clearly outlined and mapped out. In addition to the individuals entering that, map it out in your head, help yourself to visualize what you may need to experience within that, knowing that there's going to be a plan and then we need to pivot and adjust as we move through these different phases that Andy has spoken about. Attend to the individual differences. So Pacific Sport has done a great job with some of their staff and exploring the psychological readiness in terms of returning to training. And so it's asking some simple questions of how are you feeling about this? Do you feel physically ready? Do you feel psychologically ready? How does your ecosystem around you? Because I've heard some family members quite concerned about athletes re-entering. So just to explore that and having those conversations. And really it's that human first approach and making sure we're attending to all those needs. With that, it's really that connection point. And so, you know, what we'll recommend is as we're going in is check-ins, you know, so team huddles and just checking in with how everyone's doing today, almost doing a traffic light, red light, green light, yellow light, right? We know of a NPC who's monitoring within their sport that has returned and basically giving the mental health continuum and just saying, you know, on this range of you know, the continuum, where might you fit this week, how you do, and just so you can have some touch points. And I think, once again, the connection, what an amazing opportunity to share stories and build culture and build team during this time. So making sure that communication is up. And then lastly, there's a lot of great resources, which I'll show at the end. So make sure those in need are getting linked. Adaptation. And this is, you know, managing the expectation of individuals going into it is we're going to need to adjust and adapt as things move. And that challenger mindset of what a great opportunity, because in sport, we constantly need to adapt and be able to adjust to this context to bring our best. So I think within that, create space for processing as people integrate patience with the process. So yes, we have some physical and some technical performance indicators we want to reach, but also bringing people back up to speed. Control the controllables. So that's that comparison stress, I think. And it's really having people revisit the purpose and the why. And I know with some of my athletes, you know, is there going to be a competition? Is there going to be, you know, a season? Should I train? And so really bringing them back to what it's about in the first place. And it's that passion and that pursuit and that challenge and bringing their best. So do a little bit of work around that. In addition to having some key performance indicators as a team, as an individual, of what are my markers? Can I come out of this better than when I went in? And then lastly, I think a really big piece of it is building resilience. You know, as we go through and the increased stress, the antidote is getting in front of it. And so one thing I failed to mention, another thing I do is I'm a founder of a company that this is what we do, have an online mental wellness application that measures, trains, and tracks resilience. And so really, when we look at resilience, it's that whole idea, not necessarily bouncing back, but getting in front of it. Mustafa Sakar defines it as the ability to withstand pressure. At Headversity, we talk about it as the readiness to face adversity. So just like, you know, these athletes that we work with, these ski racers, we're not preparing them for the bluebird sunny day. We're preparing them for the snowstorm, the individual that just got airlifted and now they need to perform. So equipping them with the tools, the insights, so that they can tolerate the stress, handle the challenges, execute, and be well. And so just sharing a simple model that we use, but any of your mental performance consultants, this comes from the science and research and what we do. So really it's that self-expertise, knowing yourself, knowing your why and how you want to show up. Mindfulness. There's so many great apps on mindfulness, Calm, Headspace, etc. So training this right now would be a great tool. Mental fitness. So these are all these great skills that we train our athletes in. Focus, poise, confidence. These can be used during this time as well. And mental health. So making sure we know where we're at and what are some of those things we can do to promote and protect mental health. Hardiness. Ability to endure those difficult conditions. So that challenger mindset, focusing on what's in your control, developing optimism. And then the energy management, just the regulation of strategies. So this is the model we use, but once again, these are pieces that we all as mental performance consultants use. And as you're considering making sure you're over-indexing on developing your resilience. And so just quickly, the daily psychological hygiene, you should have a weekly or daily routine that typically can involve these 4 things. What's your physical health routine in terms of the exercise, eating, sleeping? What's the mental fitness or resilience skill you're going to use that day? Mindfulness, journaling. The social connection piece, as we're in this isolation, is ever so critical. And then what's that daily purpose or what's that weekly purpose? And so you're picking that purpose for each week. So creating a bit of a plan for yourself is recommended, and working with your MPC as you go along. So just to summarize, it's kind of that whole idea to care and be aware. And I thought the psychological first aid model really summarized what it is I'm speaking to here. So it's look for those common signs and indicators of stress, be aware, listen, have time for processing and communication, link to supports within the system, whether it be a peer, whether it be a professional, an MPC or otherwise. And then live. So we're dripping in these coping skills and these resilience building and mental fitness strategies on a daily basis. And so a few resources just to be aware of. Once again, game plan. Once again, if there's provincial or national, but your team doctor, your family physician, Canadian Centre for Mental Health and Sport, I know they're provincial level and above. And then your COPSN network and looking for a mental performance consultant. So the Canadian Sports Psych Association has a list of members. So if you need one, you can go there. So just a few examples. All right. That's it for me. And so I guess we'll just take the last little bit here to address any questions. So I don't know if Tom or Annie, I'll just stop sharing.
Yes. Thank you so much, Karen and Dr. Andy, for really 2 great presentations, very helpful information. So yeah, like Karen said, right now is time. If you want to put your questions in your Q&A. So I will monitor those and I will be asking them. So we do have one right now as we wait for the others to come in. But so the question we have is, In reference to the COVID task force, are all NSOs an active participant? And is there a website chat group for NSO PSO reps to gather and share info?
So the task force, obviously, they tried to keep it fairly reasonable in terms of size. So there are, I think, 26 or 27 people involved, and they do represent a lot, the cross section of summer sport, winter sports, Olympic, Paralympic, as well as some physicians, et cetera, some other CCSs in there. So they try to basically cover the full gamut, but obviously we couldn't have every sport have a representative on it. It would just get too cumbersome. The information that comes out from that, obviously the SMAC updates that come out every 2 weeks, we try to include a lot of that information and link a lot of that information in there. And as well, it's on the OTP website in terms of if you wanted to get some of those actual RSAT and other things that we publish.
Yeah.
And on our side for the mental health task force is we basically have invited anyone who's linked with an NSO, any mental performance consultant. And so they would be disseminating that information and similarly taking it out to the SMAC advisory. We'll put some information on there and linking it to, for those NSOs that don't have an MPC directly involved, getting it through the HPAs through OTP that take it into the NSO. So we're trying to make sure we're disseminating this information.
Great, thank you. The next question is probably for you, Karen. Any strategies to help managing family, friends, and their anxieties surrounding possible future travel for competition? I know you obviously touched a little bit on that, but yeah, any strategies that you can share?
Yeah, and this is the thing. There's paranoia versus precaution, right? And so there's so many different bits of information coming out, and so the rumor mill can really get going. And so I think it really is focusing on the facts. And I think, it's getting information from, the physicians, from the sports, and looking at the safety precautions, looking at the risks that they have to go into. So really focusing on the facts so that you can resume an educated, or that you can have an educated stance or information on that. And then I think with the anxiety, it's going to be normal as we go into this. Like we're all navigating this uncertainty. So I think to name that, but once again, that whole idea of not letting the emotion be the director, using it as data and seeing what do you need to feel more comfortable. We're not going to get 100% certainty or assurance at this time, but what is the information that I need to feel comfortable? So I think just normalizing that and then focusing on the facts, making sure we have that.
Great, thank you. We can give it a couple more minutes, but and maybe as a follow-up to this, and you mentioned it, a lot of the questions that I hear and that we've heard during the webinars that we've hosted with athletes is you mentioned about looking at competitors, right? And the fact in other countries that they're already training. And even though the message is like, don't necessarily worry about what others are doing, like for sure, it's like a big factor of anxiety for athletes and for coaches as we see what the rest of the world does. So it's not easy to kind of ignore, but any more thoughts on that of like, or it's, yeah, I find that a very difficult sort of,
yeah, it absolutely is. And I think it's one of those things that you can do nothing about. It's not saying don't worry about it. It's saying, yeah, that's a factor. I think once again, let's look at examples. And I know in my sport, incredible comebacks from injury into perform on demand and winning a race. And so I think we have to look at, once again, for me to perform at my top, at my best, what do I need? And am I doing everything in my control to get there? So for our skiers, we have people in Europe on snow already. We're not able to. What can we do? Well, we can do some visualization and some imagery. We can look at video and analyze that. And so I think partly it's that challenger mindset. This is my scenario. How good can I be in this? Because worrying about what everyone else is doing, where is that getting me? So I think it's to acknowledge it, and yes, it sucks, but this is the reality. And then it's really looking at, like, when we look at some of these comebacks from athletes, they they had a vision in mind of where they wanted to get to. They focused on their control and they used it as motivation and energy. And they actually came back stronger than their counterparts because they had that extra fear and anxiety. So I guess partly, don't ignore it, embrace it, and then try to, implement some things as you move forward. So that's from the mental side. I don't know, Andy, if you have anything on the other side.
Yeah, a couple interesting things is, one is what we tried to emphasize is we have the fortune of being the third wave. So COVID went through Asia, it went through Europe, and thankfully, I mean, we learned from those things so that when it came to North America, we didn't have the deaths, we didn't have the, number of individuals that were impacted. So we have learned a little bit from that, and we've benefited from that. The other interesting sort of statistic that's come out and that we're looking at now, especially as professional sports are going back, is the rate of injury is incredibly high. And that's nothing to do with COVID. It's just that people are going back to high-level sports without training, without pre-seasons, these kind of things. And so the injury rates for the typical things, tearing of ACLs, injuring shoulders, hurting their backs, are quite high. So, maybe we shouldn't be so jealous of the fact that they're going back quickly. We should say, okay, we're going to go back, keep our eye on the big picture. It's 2021 and it's Tokyo, or it's qualifying in wherever in 6 months from now. That's what's important, not whether we are training 2 weeks before another competitor in another country.
Really great answers, I think, from both of you. Thank you so much for that. Another question we have here: if the summer games resume, is it possible that it could occur without some high-risk sports being involved? Oh, I'm not sure if any of you would have the information to answer that question, or maybe Dr. Andy?
I don't think that's been brought forward. I think, it's a long ways away. It is and it isn't a long ways away, but I think the plan certainly would be that, to have all sports, whether they would alter spectators, whether they would alter procedures in the way of doing things, it's way too early to tell. And certainly, as Karen will tell you, it's beyond our control. So let's not worry about it. Let's prepare ourselves and be ready to go with the expectation that every sport and every athlete would be there.
Yeah, and I think I'd add just on that is modified games a possibility? Absolutely. And so I think it is just that, as coaches, as staff, as athletes, what do you need to do to get into the mindset for what may be? And I think, as Dr. Andy said, what can you do now to, regardless of what it is, be in your best shape? And then we go from there and pivot as we need to, as information comes in.
Great. We have about 4 minutes left. I'll give people maybe one last chance to put in their questions. And while we do that, maybe a few things we'll be sending in the chat, a link to a survey following up this session. So we encourage all of you to please complete it. It's very helpful for us to understand the sort of content that you are looking for in those webinars as we move forward and sort of the next phase of this situation that we're all working with. And then the other thing I want to talk about is we do have our upcoming sessions to end the month of June, some more wellness sessions. So on June 22nd, we have a Coach Wellness webinar, our regular Mindful Monday at noon Eastern Standard Time. So Coach Wellness 101. And then on Wednesday is a similar session for athletes this time. So Wednesday at this time, so 2 o'clock Eastern Standard Time Zone. So again, encouraged to spread the word, register for those sessions. And then we'll be coming out with our future calendar in the coming weeks to see what the next few months are going to look like. So maybe one last chance for people to ask your questions. We have two great people, two great experts to answer your questions. So it's a great opportunity. One more minute for people to type in their questions. It's been pretty quiet, so I think I don't see anything, but oh, thank you all. So I thank you. So again, thank you all to both of you for all your great advice and expertise today during the session, Dr. Andy and Karen. Thank you very much, and thank you everyone for joining. We will have, so this session has been recorded, and everybody that's registered to it will get a copy that will be emailed in the coming days, and so keep an eye out on your emails for a copy of the recording for this session. So again, thank you all for joining us today, and hopefully we'll see a lot of you next week for our next session.
Great.
Thank you.
Thanks so much, and thanks for having us and setting everything up and all you guys do. It's been fabulous.